Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your phone calls in just a little bit. Once you see that number on your screen, you can call in, but when you do call in, make sure you're in a quiet room so that we can hear you. Make sure your TV's turned all the way down so that we can hear your question and there's no other sounds so that we can clearly hear you. That number is 318-219-4569, and today's topic is all about oral hygiene. It's actually National Dental Health Month, and joining us to talk about this is dentist Ray Jarvis with Restoration Dental. Thanks for being here.
Very much so. Yeah, glad to be here for sure. Yeah.
Did I get that right? National Dental Health Month.
You got it right. Yeah, so
okay.
The ADA, American Dental Association, brought that in maybe in the early 90s as a time of year to kind of remind everyone to brush up on their oral health and oral hygiene routines. I think it's a good time of year to kind of reevaluate what all we're doing. I think people are getting ready, maybe eating healthier for the beach vacation coming up, or getting out in the sun, and so it's a good time to remind yourself, I've got to really start taking care of my teeth and gums and all that involves with that as well, so for sure.
Yeah, and what's really fascinating to me is, I'm a dietitian, but when I talk to my dentist about, just oral hygiene or, just talking to you about it, you can tell a lot about someone's teeth based on kind of their diet too.
Surely, oh for sure. I fully believe that, the foods that you eat dictate how much plaque you build up, of course, and the quality of your saliva, and the things that you drink also affect what all is in your saliva, and your saliva is what helps to keep your teeth healthy as well. And so, if you're eating whole foods and less processed foods, all those things really don't create as much dental plaque that you have to clean off. And certainly if you're eating and drinking sugary or acidic foods and drinks, that's going to create more plaque buildup and more bacteria. That's going to decrease your oral health for sure. So diet is directly related to how healthy your mouth and teeth are for sure. And then, you got to think about too, your oral cavity is the start of your digestive tract. And so if you have good bacteria in your mouth from the good foods you eat and maintaining things, you're going to have a healthier gut and a whole body for sure. So
it's all related. That's so true. And I feel like also it's Mental Health Awareness Month, and that kind of what you eat obviously can
certainly
dictate that
affect your
too,
mood and everything. Yeah.
Okay. So, but you also, as a dentist, you do the annual or the twice a year visits.
Twice a year is best, for most people.
But you also have lots of other things that you offer at your practice, if you don't mind going through that.
Absolutely, yeah. We love to see everyone at least twice a year. Some people will have to see more frequently than that, depending on what all they have going on. But we offer your normal oral health maintenance, routine checkups and x-rays, and certainly our treatments run the gamut of general dentistry as far as fixing tooth decay with fillings, or sometimes it requires a crown. Certainly root canals, we do a lot of those. I even offer, sometimes the decision has to be made to remove a tooth for different reasons, and we can offer dental implants and in the office to replace teeth. And certainly some people have to have a full denture or a partial denture. We do a lot of those too. And sometimes the patient's needs is outside of our scope of practice, and so we definitely refer to a lot of the specialists around town who all do a great job here in town as well. So,
great.
But we love enhancing people's smiles and getting people comfortable with their teeth and the way that they look when they smile, and so offer a lot of teeth whitening procedures and then different composite bonding treatments to enhance people's smiles and get people comfortable with the way that they look and feel.
Great. Yeah, and I feel like for some patients or maybe some of our viewers, the eyes and the teeth are like those visits that we tend to avoid a lot of times.
Yeah.
Do you find a lot of your patients struggle with maybe dental anxiety?
We see it a lot, and I think usually after the first one or two visits they have with us, we can kind of get them past that. A lot of it's the anxiety of like, what is the doctor going to find, or what am I going to have to go through? And usually we try to make the first visit easy for even patients with a lot of dental health needs. But yes, it's with the dentist and, like you said, the eye doctor. Usually when you go, it's not just a conversation you have and like a prescription written by your medical doctor. Usually, it's usually at a dentist. You're getting some type of procedure done, and which can be somewhat invasive. Even just a normal cleaning, somebody's doing something to you. So yeah, it can be daunting for some patients that may not be on the top of their list of things to do. So, but yes, we do all we can to keep our patients comfortable, and usually after the first few visits, and we teach you how to maintain your teeth a little bit better. The cleanings and those visits get a lot easier as time goes on, for sure. So. And, we have our great hygienist at the office that I think a lot of patients fall in love with, and make sure we have a good team, and our front desk staff make sure that you're greeted, and feel comfortable at home when you're there. And so we try to break down a lot of the barriers, maybe of what people have a thought of going to a doctor's office. And we try to make everybody more comfortable, even from the first call that you make to the office, for sure. So
that's great, and that's important, because even if someone does have a little bit of that anxiety, or if they're nervous, you want to feel comfortable. Is there any like comfort things that you offer? Like, I know there's some, like, sleep dentistry is like a big thing nowadays. I don't know if that's something that you
That's
offer.
something that we're looking into. There's a lot that's involved with that, but I think that's definitely a good option to have for like really big procedures like a dental implant. Some people certainly don't want to be late for that. And so usually I would refer to a specialist to do that. But yeah, definitely we can do nitrous oxide, which is like the laughing gas, to help people calm down a little bit for smaller procedures. There's also some oral medications that I can prescribe patients that have a little bit more dental anxiety that helps you kind of feel a little bit more relaxed. Some patients really benefit from that. And then, we offer blankets for my patients that are cold. We keep it kind of cold in our office, and so we have a whole thing full of blankets, and any fresh water that they need, and to keep them comfortable, for sure. So
So before going to your twice-a-year visit, just kind of your routine checkup, I usually try to brush my teeth beforehand. But do you guys prefer your patients to do anything before that visit, or you just are like, just come?
And then a lot of people are worried about making sure everything looks good right before, brush and floss the day before. But yeah, usually we can tell if you just are just now flossing for the first time in the 6 months. We did it last 6 months prior. So no, I mean, probably eating food right before you come in probably isn't the best idea, but that's even not that big of a deal. So yeah, making sure you're brushing twice a day and flossing. If you're not, we can kind of clean up everything and teach you again how to do it. Complete judgment-free zone. I want to make sure my patients know that we're here to help you and here to offer comfort and education and not judgment at all. And there's a lot of people have a lot of hang-ups about their teeth and are insecure about it. And so we want to make sure that we're here for educational purposes and to take care of you. And come in with whatever you got. We'll figure it out, for sure. So
cool. Okay, so now the next question I'm going to ask is, best toothpaste, flossing, and mouthwash.
Sure. All right. So toothpastes. If you have just kind of basic oral health needs, just find one that you like the flavor of. I like to make sure it has at least the American Dental Association seal on it. Those toothpastes go through a lot of rigorous testings to make sure that they're safe for everyone's teeth. There's a lot of toothpaste out there on the internet that you can buy. Some of them haven't been through the testing, and some of them offer whitening qualities. They may be quite abrasive. There's a lot of abrasive toothpaste out there that polish the stain off, possibly, but they can also, over time, maybe polish your enamel down some, which you don't want to do. And so those are the things, some of the off-brand toothpaste that are out there you want to be kind of leery of. So usually anything you can buy in the grocery store, the drugstore, is pretty safe. They have some really great toothpaste that offer some anti-sensitivity qualities to it. A lot of people's teeth are sensitive to cold or sweets. That can really help kind of minimize the sensitivity. I have to use those because I really can't eat or drink cold things without it. And so,
like Sensodyne?
Sure, Sensodyne's really good, but most of them have Crest sensitivity. Colgate has one. But yeah, I like to use Sensodyne for sure. That's kind of my favorite.
That's what we use.
I love it. And so it has a mild mint flavor, not really strong, Then patients that have a susceptibility to get a lot of tooth decay. Some patients come in every time with a cavity to fix. There is a prescription toothpaste we have to prescribe sometime with a lot of extra fluoride in there to help strengthen people's teeth. Certainly as people get into their later years in their 70s and 80s, tooth decay can kind of start creeping up again. So sometimes we have to prescribe that stronger toothpaste. Floss, there's kind of 2 or 3 basic kinds. One is the regular old waxed floss, which I like to use. It seems to have the most friction to kind of pull out any plaque that's in there. If you have really tight contacts where you're having trouble getting the floss in there, they sell the ribbon floss, Glide, and I think all of them make a ribbon type floss now, which are good. And some people like to use the little pre-threaded picks with the floss on there, so they don't have to wrap it around their fingers. Some people may have a manual dexterity issue, and those do a really good job.
Too?
Oh yeah,
okay.
People keep those in their car. It's a good thing to keep in your car if after lunch you want to kind of do it in your car. Those are always good. And then some mouthwashes. I think mouthwashes are pretty good. Sometimes the alcohol-based mouthwashes that keep the essential oils that actually kill the bacteria dissolved. Sometimes they can be a little bit. They can dry your mouth out as well, on top of killing some of the bacteria, which isn't the best thing. And so I like to try to recommend some of the alcohol-free mouthwashes they have out now. And even they have some mouthwashes in the drugstore that has some fluoride over-the-counter safe levels for kids, that may need a little bit extra time with the fluoride on their teeth just to rinse and spit out. So, but and they keep your breath fresh, and so. Without any, and then there are some other prescription-based mouthwashes for people with periodontal disease or other treatments that they need for a specific issue.
But the thing is, that's not really to replace brushing and flossing. And
I always liken it to, spraying your car with the hose, is one way to knock off some things, but you really got to scrub it to really get it clean. You've got to have something to brush off the plaque because it really can get really stuck on there. And so, so you got to brush, you got to floss, and then usually if you want to use a mouth rinse, do that after all that for sure. So.
And if you don't love going to the dentist and, having the oral hygienist get in those little nooks and crannies, doing that, in between each cleaning can kind of help with those cleaning visits.
There's a lot of, you may even brush your teeth and it looks all nice and healthy, but then under your gum line, there can be stuff building up that you could have cleaned out with the floss. And even if you're flossing, you don't really see anything coming out, that's a good thing. You're getting rid of that microscopic level of plaque that's down there. And if you don't do that daily or a couple of times a week, a little bit builds up one day and then the next day, and then it's really adhered to the tooth where the floss can't get it off. And that's why we have dental hygienists to keep those clean, and you have to scrape it off. So so if you're flossing regularly, definitely it would make your cleanings much easier, much more enjoyable. So
for sure. Well, if you're just joining us and you have a question for dentist Ray Jarvis with Restoration Dental, you can give us a call. That number is right there on your screen, 318-219-4569. It is National Dental Health Month, so we're talking about oral hygiene, but really anything related to your teeth, your pearly whites. If you have a question, give us a call. So you mentioned some of the toothpaste and mouthwash has a little bit of that fluoride being a mineral. There's a lot of talk in Louisiana legislature about outlawing fluoride in drinking water. It's something that might be passing through the Senate and the House. So, but my question for you is, what does the ADA or American Dental Association, what is their stance and maybe your opinion on that?
There's over the time we've used fluoride in our drinking water, we've seen a tremendous increase in overall public health as far as your oral health goes. And so yes, the ADA recommends the safe level is added to the fluoride or the water source for the communities. I myself have worked in Shreveport, which has fluoride in our water, and also have worked in communities in Louisiana that do not have fluoride in their water. And the difference in oral health is vastly different. The teeth of patients that live in a non-fluoridated community, even if they use a fluoridated toothpaste, it's really just not the same. We have instruments that I feel your teeth with, the Explorer. I can feel those teeth are softer than the fluoridated teeth up here in Shreveport and other places. And so For instance, children. Okay, so one thing I've heard in the news is in the age of fluoridated toothpastes or fluoridated mouthwashes, like I mentioned, why do we need fluoride in our water?
Yeah.
Well, it's a reality that some children don't get the education of how to take care of their teeth until they may be 8 or 9 years old or past that, and so they are not going to be brushing their teeth when they have baby teeth, or not brushing them well, or not seeing a dentist, and so they need that public support from the water system to protect their teeth during those years. That's when your body is making your teeth for the rest of your life, and so by the time you're 10 or 12, you have most of your permanent teeth, and if you haven't been taking care of your teeth, as we know, all kids aren't the best at doing things for themselves until they maybe get older.
Right.
And so they need that help from the fluoride in the water source. And it's really remarkable. I've got kids up here as patients that aren't the best at brushing their teeth, and they come in with a lot of plaque. And a lot of times I'm surprised by, they don't have any tooth decay, luckily. And I think, wow, that's a great thing that we have fluoride in our water source. And then in these other communities I've worked in, you get kids, 6-year-olds, that come in and haven't been brushing their teeth well, as a lot of kids don't. Plaque, on their teeth, and they're just these humongous cavities, and it's just vastly different. And so it's very important, I think, in the dental world, thinks that fluoridated public water is a very important thing to maintain. There was a city in Canada, Calgary, back in 2011, I think it was, voted to remove fluoride from their water. And that was the decision that their legislatures and community made. And 10 years later, they looked at the difference in the tooth decay rates before and after. I think that was back in 2021 where they, I think, realized the vastly increased tooth decay rate of their whole all of their citizens, and I think they made the decision to put the fluoride back in the water. So I like to remind, look at the facts of what we're doing here. And anything that you ingest can be dangerous at a certain level. You can get vastly ill from drinking too much clean water. If you take any medication that helps you, if you take too much of it, it can be dangerous. The same with fluoride. Yes, if you ingest a tremendous amount of fluoride, it's a dangerous thing, but it's very highly regulated to where in the public water source, it's a very safe level.
Yeah, okay, and so that's public water. What about, bottled water? Is that regulated, or does that have fluoride in it?
There are some bottled waters come from the public water source that may be filtered or treated in a certain way. And so, yeah, some bottled waters, I'm sure you can Google a certain brand and it'll tell you if it's fluoridated or not. A lot of them that come from a natural spring, depending on where that is, it's not going to be fluoridated. And so I think they're all different. I don't know what the regulations, I think there's really not. It's just whatever the customer wants to purchase or what the company wants to do. They may advertise this is fluoride free for the ones that don't want fluoride. And then I think the ones that even are fluoridated may not even say. And so we would have to kind of look at that.
Yeah. And what about, so it definitely has an effect on children, but what about adults as well through the lifespan? Yeah,
definitely with children, it's not just the topical drinking of the fluoride in your mouth, but also like systemically, it when the teeth are developing in your bones, the fluoride is incorporated into the tooth even when they're developing. But certainly as adults, teenagers, even elderly patients, fluoride in the water source when you're drinking it throughout the day continually re-strengthens your teeth and protects it, right? And so because every food and drink for the most part is somewhat acidic, and so it can slowly kind of bring the acidity level up, I guess, or the pH down, and that can kind of dissolve your teeth a little bit, and so you need that fluoride to re-mineralize those your teeth throughout the day.
Right.
Yeah.
So with you mentioned in the cities where there wasn't regulated or wasn't fluoridated water, the teeth were softer. So it just like you said strengthens because your teeth are bones, right? They're kind of.
Well, kind of. It's not really a bone. It's a mineral or it's called, it's different from a bone. But
so wouldn't affect your bones as well. It's mostly the teeth that we're talking about.
At a safe level, I think,
Yeah.
yes, at this dangerously high levels, of anything. But yes, I think at a dangerously high level, it may affect your bones. I don't really know.
Yeah.
But no, it's like I said, the studies have been done. Like,
Right.
you got to trust science, and so yes, very safe levels of fluoride are good for your teeth.
Very
and
interesting.
Yeah, so
Yeah, no, thanks for
Yep.
weighing in on that, because I know that a lot of people have questions.
It's a big talk about it,
Yeah.
and it, as they should be, very careful about what is in a public water source and what we're all ingesting every day. But I think with fluoride, like if you want to have healthy teeth, like it's a tremendously good thing to have for sure. So.
Okay,
Yep.
great. All right. So again, if you're just joining us and you have a question for Dr. Jarvis, send us or not send us an email, just give us a call, 318-219-4569. And so now that we've talked about that, let's move on to something, like cosmetic.
Certainly.
You definitely help people get their confidence back
Yeah.
a lot of times. And one thing that you don't, like maybe you think about when you see someone, a lot of times the first thing that you see, especially when they smile,
Right.
is their teeth and their smile.
Yep.
And so, tell me a little bit about what you can help people with when it comes to cosmetic things.
It may be something as small as changing the shape of one tooth or closing a small space with a little filling. It can be something even small as that can change a tremendously amount of someone's appearance. Sometimes it does require a full set of like a veneers or crowns, certainly. Some people just need to brighten the color of their teeth. They've had years of coffee drinking and need to just whiten them. That takes a few visits, or we make some custom trays people can wear at home. But and so one of my favorite things to do is certainly to help people love the way their smile looks and appears and feels. I think it boosts everyone's confidence when they get that done, and they really enjoy the investment they made in time and money into that for sure. So, but yeah, it could be some people need some really nice set of crowns and veneers. Sometimes it's something easy like I may send you to an orthodontist to close the spaces up in your in your smile, or fix the crowding that may be going on. Sometimes I can even fix the crowding, like I said, by like a single crown or a single veneer, or just a simple little composite bonding procedure to get your tooth to a more pretty shape.
Yeah. And the best thing to do would be to schedule an appointment, right? And then talk about those things.
So, I always have people come in and address any concerns they may have right off. And then if I see some things that we could improve, I'd like to bring that up. But so, schedule an appointment with a dentist or myself or Dr. Patton. Certainly we can take care of you. But yeah, don't be surprised if when you come in and say, I would love to have a set of veneers. That may not be what I suggest. There may be a better way to do it that's less invasive. We always look at the least invasive ways. Like we talked about with fluoride, like you only get one set of teeth. And so we're very careful of when we do procedures on teeth and when we decide not to. That makes sense, yeah.
And you're probably also giving realistic expectations. So if somebody comes in and is like,
yeah.
I want to smile like this, you can probably say,
that's
well,
happened
this
before.
is what we can
That's
do.
happened. I've had patients come in with a picture of a celebrity, like my teeth should look like this. And we look at the shape of your face.
Right.
That dictates the shape of what teeth you should have. Sometimes if those two things don't mesh up, it can look unnatural. And sometimes it has to do with how the teeth are positioned in your smile. If you look at your smile, some people show more of their teeth and some people show less.
Right.
And that means that you can't always have a certain looking smile.
Yeah.
And so I like to explain all those things. And managing expectations is a big thing in dentistry and lots of things in healthcare.
Right.
But we can do a lot, but there are limitations of what we can do for our certain patients. Yeah.
Yeah, and so this would probably be like an elective procedures, or depending on what it is that they're wanting or what you suggest. So I can imagine it can get a little expensive at times, but depending on how much they're wanting to do. So what would you say if somebody's like, I want to do like all these different things, but it doesn't make sense? Can you do it little by little over
Certainly.
time? Yeah.
Most of the time we can break it up into segments.
Yeah.
There's a few cases where we have to do everything all at once, but that's kind of usually I could break it up into even over the course of 2 years or so. We have a company that can finance our dental treatment for our patients over the course of 1 or 2 years if they want to pay it out. But yes, usually I can, if the patient has a lot going on or a lot they want to get done, I can even make long-term temporary restorations for patients. That way they can even try out the way that teeth may look, and they may see things that they want to change. But yes, usually I can do like this area first, and then you can get that done, and then 3 months later we can do the next little area, and we can kind of break it up as much as patients want to, for sure. So,
cool. And you said restoration. Is that kind of why you chose Restoration Dental?
It is, yes. So that's what we do. So any type of I didn't even know I said that. So any type of filling or a crown or a veneer is, in the dental jargon, is a restoration. And so, but yeah, we're restoring smiles with our restorations, for sure. So
cool.
That's just what we do. We like to fix our patients up and get them comfortable. And so, restoring people's smiles and maintaining everyone. So,
no, that's great.
Yep.
And do you have like a specific patient that you can think of where they, came to you for the cosmetic reasons, and they, walked away feeling, full of confidence?
Certainly. There's a big list of them.
I'm sure.
So I'd love to bring one on here one day. It's always
that'd
fun.
Be great.
It's always fun when you see someone that you did, some work on them 10 years ago, and you see how their life has changed. It's really remarkable. Like a lot of, not just female patients, but this one lady who I'm thinking of, we did a lot of work with an orthodontist to get her teeth in the right place, and then a full set of crowns. And she comes in like she's dressed nicely, not like she didn't before, but just she's a whole body confidence.
Yeah.
And I think, talking to patients like that and seeing how their life has changed over the years, get a better job because you're more confident and speak more freely because you like your smile, or people interact with you differently. And so it's a lot of fun. People don't realize how much of a change can be made. So
absolutely.
Yeah.
I love that.
Yeah.
So I currently wear a retainer, and I think I've asked you this question before, but I think it's worth mentioning again. But what do you suggest for the best way to clean that retainer?
The retainer?
Yeah.
I know there's a lot of things out on the market now that patients can buy over the counter that usually do a good job. I usually like just to remind patients, don't use toothpaste on it. That can be, like I said before, even the good toothpaste are somewhat abrasive. That can scratch up that plastic on your retainer and make these little micro scratches that bacteria and plaque can grow on your retainer. And so I like to have patients have a dedicated toothbrush to their retainers, and just use soap is a good thing, like just soap is good. But then they also can sell there's some ultrasonic cleaners that you can buy from wherever, and they do a good job too. You don't necessarily have to soak it in any water or cleaner at night, but just make sure when you're brushing or cleaning it not to use anything really abrasive that could kind of scratch it up.
Yeah, that's good to know.
And then always I have my patients bring them in at their cleanings, because I have a very good cleaning machine in my office that I can clean them for twice a year. A lot of patients have to wear night guards. Those need to be cleaned regularly. Some people, plaque and tartar builds up on those faster than others, and we can always get it all off with our cleaning machine too. So bring those into your dental appointments, whoever your dentist is, and so that they can usually clean it better than you can at home.
Yeah, I didn't even think about that. And it's kind of like when you go to the jewelry store. I mean, I don't know if you can resonate with that. I resonate with that. But you go to the jewelry store, you bring all your jewelry, and they clean it for you while you're shopping around.
It's kind of the exact same machine. They sell it from the dental supply company. But yes, it's an super ultrasonic cleaner that cleans all the stuff.
Okay.
And so patients with dentures and partials, we clean them for them. It's the same machine.
Yeah, because you probably, one of those things that you may neglect sometimes.
Yeah, I mean, it adds up. You think of all the things we talk about. If patients are having trouble remember flossing, are you going to remember to clean your retainer too, or your partial? So we can always do it for you. But yeah, bring those in, and we can also evaluate if you're grinding through your retainer or grinding through your night guard.
Just by the way it looks.
Oh, for sure, yeah.
Wow.
For sure, yeah. You can. It's remarkable. People that grind their teeth, you make this pretty little splint for them to wear, and they'll grind pathways into the plastic. It's really remarkable. And so sometimes we need to replace that. But yeah, definitely those clear retainers, they can get worn out as well. So
earlier this week, I woke up and I wasn't able to really fully move my jaw, and I don't know if it's because of the way I slept or if it was because I was grinding my teeth. I don't know.
Yeah.
Maybe
you
worth
may,
looking into.
Patients like that need, can have a retainer from their orthodontist, which does a great job holding their teeth in place. But sometimes you need it's called a splint to hold your teeth and your jaw in a certain position, or a little bit more open than what the retainers do. The splints can act as a retainer as well, and so patients like yourself that are waking up with symptoms, you're doing something at night. It's usually not how you're sleeping. It's usually something's placed in your jaw into the wrong spot. So patients like that may need a more specialized shaped splint.
Okay, good to know.
Good to know. Ask your dentist about it.
Yeah, no, that's interesting. I definitely think at one point I was, but I've had orthodontic work. I had an overbite, and my jaw pops now with all the work that I've had done over the years when I was a kid. And so sometimes, I don't know. You just never know unless I do like one of those things. So we'll see. We'll check back in with that.
That all throughout your whole life, it can change. At any point in time, you can start jaw pain and clicking and popping. So, all good.
And you are accepting new patients. So if someone is interested in setting up an appointment, how do they get in touch with you?
Yeah, so we're on Fern Avenue between Burt Coons and 70th and Sand Beach Office Plaza. And call us. The number's right there, 797-1181. We'll love to see you.
All right, great. This has been very helpful and got a lot of great information. And thanks so much for joining us, Dr. Jarvis. And thank you for joining us. If you missed this will be on our website at ktbs.com/podcast. It's also available on Spotify as well. Thanks for joining us.